Hi YouTube! So, I had my prenatal appointment today. Today is Friday, February 21st, 2014. And I had my, I believe, 7th prenatal appointment today. And today's appointment had to deal with finishing up the anatomy of the baby. The anatomy was done. And it turns out that her heart looks really good and healthy. Also, my cervix was measured because they do like a cervical measuring, and the cervix looks normal. It doesn't look like I have preterm birth or anything like that. Let's see. Okay, this is the only problem, is that apparently I've gained 6 pounds. Yeah, in a matter of 3 weeks. But I would say that since I ate this morning, and I drink a lot of water, and I drank some coffee prior to being weighed, I'm going to say I gained 4 pounds in the last 3 weeks. So they want me to chillax a little bit on the carbs. Honestly, the last 3 weeks have been tough. I have been eating like a slob, so I need to relax on that a little bit. I worked out, did some cardio. Look at them. I'm trying my best. I still do cardio, but I do not recommend it for everyone, because for those of you who've never really worked out prior to pregnancy, as I've mentioned in my last videos, do not work out if it's not recommended for you. In my case, I can pretty much handle it. I don't do extensive or extreme workouts like insanity like I used to, but I still do cardio. So today I did 12 minutes of cardio. I sweated a little bit, but I took the breaks when I needed to, and if I felt like I needed to, I took my breaks. And I have been lifting 15-pound weights. Next week I shall move up to 20 pounds, hopefully. But anyway, I'm 19 and a half weeks along. Aside from the weight gain that has happened, that they want me to just kind of like cut down a little bit on the carbs and try to eat just a little healthier. And honestly, like I said, these last 3 weeks have been honestly boo-boo for me, a really big boo-boo, so I need to relax on that. What else is going on? It's, well, I have the picture of my baby. They gave me a 3D picture, so here it is. That's my baby. It's the same picture, but let me get this up close. That's my baby girl in 3D. So, it's exciting. Nothing special. But I remember speaking about my blood sugar being low. And they wanted to make sure I don't have low blood sugar. They were asking me if I felt dizzy, lightheaded. And it's hard to really say because I suffer from hypertension, which is low blood pressure. And so it's hard to really say if what I feel when I'm dizzy, if it's low blood sugar or what. So they pricked my ring finger today. I'm left-handed, so they had to prick my right hand. And my sugar level was 80, which is good. It's normal. I ate this morning and my sugar was 80. I drank coffee and my sugar was 80, so I'm pretty happy about that. The last blood work I did was on Wednesday. I mentioned that. I went to my transplant doctor. They drew blood, and my sugar level from Wednesday was 60. So that's a little bit on the low side, but that's because I hadn't eaten breakfast that day. Or did I? You know what? I don't even remember, but I'm pretty sure I didn't eat breakfast. So next time I go to my prenatal appointment, I'm going to make sure I don't eat, so that I can get an accurate weight. But then as soon as I get weighed and all that, I will eat as soon as I get that done. Because usually I have my prenatal appointments at 9 in the morning. So it's like so early and I could still have breakfast after. Aside from those things, nothing else is pretty much going on. I'm just going to focus now. I'm going to make sure I focus now on doing a lot more cardio. Not extreme. Because my boyfriend was like, listen, don't go crazy with it either. So I'm not going to go crazy with it, but I'm going to make sure I do just more cardio. Because I've been doing a lot of yoga, some minor cardio, and some weights. So I do know I have muscle. I mean, you could kind of tell, I guess. But, you know, I'm going to start incorporating a little bit more cardio into my workouts now. It's just I didn't want to do so much because I remember my doctor telling me she doesn't want my heart rate to increase so much because it's kind of removing the blood flow from my baby and it's going to my brain. Which, I mean, it's a good thing when blood goes to your brain and you're working out on a general basis, but when you're pregnant, you don't want that. So the blood needs to go, you know, to the baby. But I mean, come on. the production of blood in my body is like extreme. Like you get an increased blood volume in general, so I doubt I'm removing so much blood from my baby. You know what I mean? So I did a 12-minute cardio workout. See, I'm not trying to do something crazy either. Uh, so the total weight gain that I've calculated at me being 19 and a half weeks is 15 pounds. And it freaks me out a lot because when I first met my boyfriend in 2012, I was 110 pounds. And I hate to repeat myself, but it kills me. And so I met him at 110 pounds. About a year later, I was up to 125 because I quit my job at Planet Fitness. I was working at Planet Fitness and I was very on the move there. And from that job, I went to a really sedentary job where I was sitting down in an office doing paperwork and computer stuff and whatnot. I was a receptionist. So I don't fully blame it on the relationship and happiness. I also blame it on the change of job because I was so active at Planet Fitness, and when I started working at the receptionist job type of thing, I became less active, and I honestly stopped working out as much as I used to. So the 15-pound gain in that year was really just because I became less active. And when you become less active and you're eating as equal as you were prior, you gain weight. It's just normal. But I remember also going on a low carb diet, and that helped me go back down to 115 pounds. But I kind of lost track of that too, and it's like you're not supposed to go on a long-term low carb diet. When you go on a low carb diet, you're supposed to do it for not more than a month. As a matter of fact, you're supposed to do it for 2 to 3 weeks, and it does really work. And it helps your appetite decrease. So for those of you who feel like you'd want to lose a few pounds, remember diet is key to losing weight, gaining muscle, to doing all of that. Diet is key. So low carb diets are very effective, meaning you have to stay away from all carbs like pasta, bread, all those high carb stuff. Low carb things such as eggs, cheese, nuts. There are a lot of low carb things that you can eat that are actually healthy, but you're not supposed to continue a low carb diet for a long term. So I had actually lost weight and gone down to 115, so that was a good 10-pound loss. But then I went back up to 125 because I don't know, I lost myself with the whole working out, and so I was 127 when I found out I was pregnant. So 127, and now I'm 142. That's a 15-pound gain. I'm not gonna stress it so much. I'm just gonna make myself work out more. And I'll keep in mind too that I got pregnant in the fall to the winter. So as soon as spring hits, there are no more New York snowstorms, and I'm able to go out there and start walking. Then I am going to do more walking and light jogging. So that's very good for pregnant women. Walking. I'm not going to suggest jogging for pregnant women. I'm going to suggest walking. If you want to do any kind of jogging, you ask your doctor. In my case, I'm not going to lie. I don't follow doctor's orders 100%, and I never have. Honestly, with my first kidney transplant, I didn't follow doctor's orders. I was supposed to be on bed rest. And a week after my first kidney transplant, I was working out. Yeah. So, I'm not too keen with following doctor's orders 100%. I don't find that to be a problem because not even doctors 100% know things, and you just follow whatever you feel. And honestly, someone like me who's still working out and lifting weights and stuff and pregnant, I know my limit. So if I start feeling lightheaded, if I start feeling any sort of weird body changing, I am going to stop what I'm doing and make sure I relax. So I am not condoning any kind of workouts for pregnant women out there. You have to follow doctor's orders. But do what you do, and make sure you take lots of rest when you feel like your body needs it. In my case, at this point, honestly, I want to take naps. I want to take so many naps. But honestly, I don't want to stop continuing my day as it is. So I feel like if I take a nap, it's going to kind of just cut some time in my day where I could be using it for something. you know. So usually in the morning I work out, I try to eat healthy, I take care of things for the baby, and so it's like time for nap. That's not really me. Maybe I nap in the week on the weekend because I'm off from work and stuff, but that's about it. So what else do I have to say about my day and about my appointments? My doctor, she told me today that my creatinine is zero point 0.9, and it's been zero point 0.9 since I got pregnant. And as a matter of fact, since I received this second transplant, my creatinine has been zero point 0.9 to 1.1 kind of range since my second transplant, of course. And I think that's fantastic. I'm so excited because they say that when you're pregnant, your creatinine does increase a little bit. So also they say that because of the high blood volume, that the prograf in your body gets diluted. The prograf / tacrolimus, it gets diluted in the body. So sometimes they have to kind of increase the tacrolimus a little bit so that it can be kind of just evened out, balanced within your body, because we don't want kidney rejection, of course. You know, nobody wants that. And according to Nika, who is my inspiration to doing kidney videos and pregnancy videos, she mentioned in one of her videos that the kidney loses function when you're pregnant, and I didn't take that into consideration until I heard her talk about it. And yeah, you know, there are a lot of factors. Not only does pregnancy decrease your kidney function, but your kidney is already decreasing in function as the years go by. So I'm not going to be negative on that, because so far my health is really, really good. And as a matter of fact, my OBGYN, she told me to just try to eat healthier, but she also looked at me and said that I don't look heavy, I don't really look like I've gained much weight, so just keep taking care of myself. She told me I look good. She's a very honest OBGYN, I can say that much. The reason why they're so concerned about my weight gain is because I've mentioned in my past videos I am 4 feet 11 inches tall, or short, and they don't want me to gain so much weight because that's going to be such a burden on my body. I'm already a petite girl. I'm a pear-shaped petite girl, and I shouldn't be imposing so much weight upon me. That's why I want to take it, more serious and follow a more healthier diet. My boyfriend said that he is going to make sure that I eat healthier, because like last night I was craving KFC, so we went to KFC and I got chicken, mashed potatoes, macaroni and cheese. But anyway, no more of that. No more of that fast food stuff. And I only did the fast food stuff maybe 3 times this week, so no more. And we are going to a diner today after he gets out of work, or after I get out of work and I pick him up. We're gonna go to a diner, but usually what I like from diners is eggs. I like to eat eggs any time of day. I feel like breakfast is like the best meal of the day. So, but I'm not considering the eggs. I'm gonna consider doing a veggie burger. I really, really, really like veggie burgers a lot. So I'll be doing maybe veggie burgers with sweet potato fries, or if not, I will do a veggie burger with a salad on the side or something. You know what? Don't know if we're gonna have time to do a diner tonight, but if not, then I'll just make sure I eat something healthy in general. I don't wanna, lose myself in this diet. So I can definitely tell by my cheeks as I'm looking at myself. I can see that I'm gaining some weight. Well, 15 pounds is very noticeable. So yeah, I can tell by my cheeks and by my arms. They're a little thicker. Also, I tried on a pair of my old jeans. Well, of my jeans. Well, the jeans I had prior to pregnancy. I'm normally a size 3 in jeans. So I tried them on, and they just won't go past my hips. Remember, I'm pear-shaped. I'm still not prepared to show you my body. So maybe when I hit 20 weeks on Tuesday, I will post a video and show you my stomach finally. But as of now, I'm not prepared for that. So anyways, I was mentioning, I tried on my jeans, and they don't go up my hips, but they go up my thighs and my legs. And but they wouldn't be comfortable to wear in general, so I'm sticking with the maternity clothes. Now, for any female out there who's pregnant, whether you have a transplant or not, I feel like Walmart is one of the cheapest places to buy maternity. And a lot of women don't know that although Walmart doesn't have maternity clothing at their store, they do have maternity clothing online and very, very cheap. I have bought maternity pants for like 12 to 14 bucks. No more than 14 bucks per jeans. And my shirts are like 8 bucks, 9 bucks. So it's really, really cheap. Also, one of my co-workers recommended H&M. So H&M actually has maternity in their store, and they're really, really cheap. You can find them on clearance. You can find, and even Kmart, they have a lot of clearance maternity. So I recommend all that. I think it's pretty good. As a matter of fact, this weekend I'm gonna check out Kmart and H&M to see what kind of maternity wear I can find. Because although we're pregnant, we still want to look cute. Am I right? High five. High five to all the pregnant women out there. We don't want to look like they did back in the days. Back in the days, they were wearing like nightgown looking things, with flowers that looked really, really old and silly. We don't want to look like that. We still want to look cute, stylish, fashionable. Like even with a baby bump, we want to make sure we look cute, So, okay, this is just like me just venting and talking. But, it'd be nice if you guys just comment at the bottom right here if you guys have any questions, concerns, or anything. Aside from everything I've mentioned with my appointments, there's nothing more to really talk about. But you know what? This whole YouTube video stuff is becoming more cool for me. I'm liking it a little bit more because I get to just vent and just whatnot. That's my dog. If you keep seeing him walk in the background, that's my doggy. That's Monkey. Monkey, come here, my love. Come here, Bunch. Come here, my sister. Come here, boo-boo. Come here. Come here. This is my doggy. I know I've shown him before, but he really loves me. This is Monkey. He's already 4 years old. He is a Shih Tzu Poodle mix, and I got him when he was 3 months old. I know this has nothing to do with the transplant and kidney, but come on. Just, don't you think he's adorable? He needs a big haircut, that's all. Mwah! I love you. Anyway, he's 4 years old, and I got him when he was 11 weeks old. He's 5 pounds. Right now he's like a good 11, 12 pounds. Well, that's the most he grows. He doesn't grow any more than that, so he always will kind of look like a puppy, I guess. So, and I trained him, and within a week he knew so many tricks. He's a really smart dog. They say poodles are the smartest dog, like number 1. No, excuse me. They're number 2. Number 1 would be a border collie. I'm sorry, I'm really in love with dogs. Who knows? I'll start like posting videos about random information that I'm interested in. I don't know. You let me know if that sounds so silly or not. But aside from everything else I've mentioned, like I said, trying to see if there's anything else. So my doctor wants to see me. She wants to see me in 2 weeks, but she honestly told me that from that 2-week period on, she would like to get my blood drawn weekly to see if my creatinine levels remain as is, because at this point I guess the creatinine levels have that risk of increasing. So in 2 weeks will be March 7th, 2014, and from that point on, every week I will be getting blood drawn, as of orders from my OBGYN, and every week I'll be getting my creatinine checked to make sure it remains at 0.9. 0.9 is fantastic, and I feel good. Oh, and as far as the constipation, that's pretty much gone already. I don't know why, but I have been able to use the bathroom every single day, and it's kind of cool. I feel like a relief from that, because in the first trimester was difficult because I felt like I was constipated every single day. It was tough, and I felt like I had to really concentrate on using the bathroom, if you know what I mean. Also, even though I do feel more sleepy, I can't necessarily say that I don't have more energy, because I do have more energy. In the first trimester, obviously it's my first pregnancy and I'm not used to being pregnant, so the hormones kind of like really messed with my brain and had me tired a lot of the time, and the working out was tough for me. But now that I'm in my second trimester, I feel comfortable working out. I feel more energy, And yeah, after I'm done working out, I usually feel sleepy. As a matter of fact, right now I don't feel sleepy. But usually, yeah, sleepiness is very common now. Although in the first trimester, the 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 tiredness was more like combined with the sleepiness, and it was a little bit more difficult. Unfortunately for me, I've mentioned before, I didn't get any morning sickness whatsoever. I wasn't throwing up. I wasn't sick to my stomach. I probably had some minor nausea, and that's about it. So it was a pretty fortunate pregnancy for me. And as a matter of fact, my boyfriend's sister, she's also pregnant. She's a month ahead of me. We work in the same daycare, and the only thing that I've noticed, because it's nice to kind of compare pregnancies, not to be silly or competitive or anything, but she's if I'm 19 weeks pregnant, she's 23 weeks pregnant. She's going on 24 weeks, so she's a month ahead, and she's been showing a lot since she hit 5 months pregnant, or actually 4.5 months pregnant. She's now like a basketball, you know. But I mean, she's a really thin, tall girl, so she's opposite of me. I'm short and pear shaped, and she's just tall and I guess you can kind of say banana shaped, sort of. Well, she has bigger top. So, because of our body shapes, in her case, she's showing more, I guess. And in my case, I haven't even popped or hardened yet. I mean, I am popping a little bit, but I haven't hardened fully yet. So that's why I'm a little bit ashamed to show my stomach. I do a lot of ab workouts too, so I don't know. Anyway, I think it's my time to go, people, because it's 1 o'clock and I work at 3, so I'm gonna start getting myself prepared for work, even though it's gonna be a quick preparation. Anyway, guys, so like I said, post anything you want downstairs here, comment, questions, anything. I will post another video, not on the weekends, because the weekends is for me and my boyfriend, but during the week. Ooh, excuse me. During the week, I'll be posting more. See you guys. God bless you. Keep it positive. Keep it real. Keep it simple. Keep it easy. Keep it safe. And enjoy the videos. And I hope it inspires you and all that jazz and good stuff. God bless. Peace.